Hey, you're listening to the Deep Dive from Book Podcaster. Feeling like your brain's just overflowing lately.
Yeah.
Maybe trying to cram everything in for an exam. Yeah, we've all been there. Think of
Right.
us as your study buddy, the one who's already got the highlighter out.
And today we're sort of wading into community mental health nursing. We're pulling insights from psychiatric mental health nursing, concepts of care in evidence-based practice.
Exactly. So when you think mental health, maybe you picture, I don't know, someone on a couch in therapy. It's important, definitely. But we're going a bit deeper today, looking at how well-being is supported, out there in the community, where people actually live and work. Our mission is basically to pull out the really key stuff, the important bits, so you get a solid handle on it.
Okay, so let's jump right in. Community-based care, what is it? Well, essentially, it just means taking mental health services outside of the usual hospitals, bringing them directly into the community.
Right.
So imagine having support systems, like right in your neighborhood. Things like outreach programs, maybe educational workshops, support groups, all close by.
Right, meeting people where they are, basically. Not making them come to a clinic necessarily.
Uh-huh.
And that proactive part, that's where it gets really interesting, right? Because
Mhm.
it links to prevention and early intervention.
Precisely. Community mental health nurses, they're often in this unique spot where they can identify individuals or groups who might be more vulnerable. And by offering support early, sometimes you can head off more serious problems before they really take root. It's like spotting a wilted leaf on a plant early.
Yeah, makes total sense.
Uh,
Tending the garden. And this fits into that bigger picture, too, integrating mental health with, like, general public health efforts.
Yeah, absolutely. And what's really great there is how it helps to, normalize mental health. It chips away at the stigma. When mental health support is just part of regular community health stuff, it feels more accessible, less scary, maybe.
Hmm.
It becomes part of taking care of the whole community's well-being.
Like finding mental health info at the library next to the cookbooks.
Yeah.
Okay, so it sounds like this isn't a job you do alone.
Oh, definitely not. Collaboration is huge. It's fundamental, actually. These nurses, they work super closely with all sorts of people: social workers, schools, housing folks, community centers.
Right.
It's a team effort. That way, people get support that's, joined up and comprehensive. So, for instance, a community nurse might team up with a school counselor, maybe develop a program for students dealing with anxiety.
Got it. So it's not just the direct care then. It's also
Yeah.
about making sure the community actually has the right supports in place.
Exactly that. Advocacy is a big part of it.
Yeah.
Community mental health nurses are often pushing for necessary resources. Things like accessible mental health services or maybe shelters, substance abuse programs.
Right.
They're trying to strengthen that whole community safety net.
So could you give us a quick picture, like what does a nurse doing this actually do on a typical day, maybe?
Sure. Okay. Imagine a nurse at a community mental health center. They might spend part of the day counseling someone who's struggling with addiction. Then maybe they're helping a family who's facing eviction connect with emergency housing resources.
Wow.
Or perhaps running a support group later for people managing, say, chronic mental health conditions. It's
Yeah.
very practical, hands-on stuff in real-life settings.
Okay, let's try and wrap our heads around this then. Community mental health nursing. It's really about being proactive, getting support to people, working with loads of partners, and fighting for resources. Sort of building that strong foundation for everyone's mental well-being.
That's a great way to put it. And for you, listening and learning about this, understanding this community focus, it really shows how mental health support goes way beyond just therapy. It highlights how vital these community-level actions are for, well, creating healthier societies overall.
Taking all this in can feel like a lot sometimes. I get it. But just remember, you're building this knowledge bit by bit. You're doing great. And hey, here's something to chew on after this. If our communities had even stronger, more integrated mental health support right from the start, how might that actually change things? Could it maybe reduce the need for the really intensive stuff later on? Just something to think about. Keep going. You totally got this.